And I think we'll begin. Good evening, everyone. Thanks for being here on a Wednesday night, January 12th, 2022. Happy New Year to you. We are eager to connect virtually tonight. My name is Josh Beauregard. I am UVA's head of school, and here tonight with my esteemed colleagues, I'm going to provide some intros to leaders who are also present and here and eager to connect with you tonight. Andrea Williams is here, a co-principal of teaching and learning at the middle school. Melissa Duffney, our Chief Academic Officer, is here. Chris Dosher, our Director of Administration, is here. Michelle Roy Gaines, our Director of Special Projects, is here tonight. Martine Luisma, our high school co-principal of teaching and learning. And finally, Casey Burns, our co-principal of culture and ops at the middle school. Just a quick update for folks who've been in the mix and know the high school scene and middle school scene from long ago. Grace Yoon, Miss Yoon, our co-principal culture and ops, recently had a baby on Saturday. So she is proud, happy, healthy, everything is good, and she sends everyone here her best wishes. So I think what I'd like to do is I'd like to move on to the next slide, Mr. Dosher. And I would just say thank you. Thank you again for being here, and more generally, thank you for your commitment to our continued collaboration as we make the most of this year in the safest, best way possible. It's been a challenging year thus far, but we've got a lot to celebrate and more good work to do in the coming months. We can go to the next slide. So I want to begin tonight where we left off. And so I should also say that tonight's session is being recorded, as Mr. Dosher said, so that families who perhaps aren't here or who want to watch this again can do so. So this will be available to you. But last summer, I think it was August 26th, we said the following. We said, we will continue to offer the best possible education experience for all of our students with our mission of student empowerment and student fulfillment being realized. We also said in August that this means shifting back to in-person learning for all and doing so with safety and well-being at the forefront of our minds. And we said we continue to lean on our strengths of being responsive, nimble, and collaborative with our families as we experience this year together. And we continue to do that. And I have pride in our approach thus far and our continued approach alongside one another. So let's continue. So throughout the fall, our approach to promoting safety in our school was very effective at mitigating the spread of COVID-19. Relatively few cases in comparison to many of the schools in the city, and there's much to be proud of. And again, that was due to our collaboration and seriousness with which we approached being safe in school and wanting to be in person each and every day. In late December, as you all know, the surge of COVID and this new variant, Omicron, hit the city pretty hard and hit our school pretty hard as we had an increased number of cases, which then caused us to move to remote instruction for the last 4 days of December and over the course of these first 2 weeks of January as we reassess conditions in school and also plan forward for what revisions to policies and protocols we feel are best in continuing with that priority of safely being in school. Next slide, Chris. And so with that, we're here tonight to talk about some of the changes to our policies and protocols. And so there are 3 objectives for tonight. The first is to share our latest plans with families as we return to in-person instruction this coming week. Second, to identify, clarify, and emphasize where our collaboration continues to matter most this year. And then finally, to gather and address any questions that you all have as collaborators so that we're on the same page leaving this meeting and doing our work in the best form possible on behalf of our kids. I will say, as Mr. Dosher said at the beginning of this meeting, this is meant to be an info session, so there's not going to be a lot of back and forth as I share out some of the updates to protocols and policies, verbally anyway. But in the chat, we invite and encourage any questions that come up over the course of this session, pose them out, and members of my team are here to field them. At the end of the session tonight, we will synthesize and address verbally some of the questions that commonly came through and the way in which we are addressing them overall. So that'll happen at the tail end of this meeting. So again, we encourage you to put your questions out there in the chat, and we'll answer them in real time as well as toward the end of this session. The agenda for tonight is as follows. We're going to kick right off with major updates. And so what are the big things we're doing to make schools safe in person for January, February, March, moving forward in the year? And then what's our plan in the short term? How are we re-entering school as of this coming week on Tuesday morning? And then what we're going to do is we're going to shift to some of the preventative measures that we have in place. And I'm going to provide some of the updates that we are now employing with this changing setting and this new variant. Toward the end of the session, as I said, there will be a report out of frequently asked questions and our responses to them. And then toward the end of the session, or at the very end of the session, we will ask for your feedback via a short survey. And that's going to be really important to how we continue on from tonight, having your full ideas, questions, concerns represented. So I think with that, we'll also take attendance tonight based on the completion of that survey, just to get a sense of who's here. And we're up to 185 people. We're almost at 200. So welcome everyone if you're just joining us now. We can go to the next slide. So major updates. We're going to jump right in. And so as of this Tuesday, we're going to be implementing a test to stay policy at our school. And this is a policy that the DOE is now running in schools, and it's something that is provided by the CDC as best practice. In a nutshell, what this policy will do or means is that there's going to be increased COVID testing available at our school in kit form, and there will be less relative quarantine going on for students who have close contact but no symptoms. And again, this aligns ultimately with increased safety and with more consistent in-person learning in our school, both good things that we've been aiming for all year. So on the right, you see a diagram where the font is small. I'm going to talk you through that verbally, and you'll see on the left is a summary of exactly what I say. So here we go. So how does this go down, this sort of test to stay policy I'm referring to? So let's say your child is exposed to COVID in our school. And let's say this happens in the coming weeks. In that case, your child would receive an at-home test kit. In that kit, there are 2 tests. And your child will be sent home with that along with instructions for how to then administer that test. And on day 1, when your child is home that night, you would administer the first test of the 2. And if the test is negative and a child has no symptoms, they could come back to school the next day. And so that's very different than the way we've approached things thus far. So we haven't tested as frequently, and we quarantine for a longer period of time, regardless of symptoms. So moving forward, if the test was positive on that night, that means your child has COVID, and it's important to care for your child, and they wouldn't come to school and they would quarantine for 10 days. Going back to that case in which the child tests negative on the first occasion, that would be the first night. They'd be back in school, and we would ask that, assuming there are no symptoms over those days, your child would test again on day 2, 3, or 4. And if the test is negative, they'd return to school. If the test is positive, they have COVID, and they would stay home, care for themselves, and they would quarantine for 10 days from school. And so different in approach. Again, what this translates to is us making tests and relying on tests much more often than we have, and using those tests to make better decisions about whether kids can safely return to school or not. I'm going to have Ms. Roy Gaines, who's been doing a lot of research on this and leading the way as a special project, a very important special project, provide any additional insights, Ms. Gaines, that I may have missed.
I think you definitely captured it, Mr. Beauregard. I would just add, for families who may be feeling anxious about this shift, this is based on a couple of studies that the CDC did from 2 school systems, one in California and one in Illinois. that found that there wasn't any evidence of more transmission in schools with this policy as compared to the quarantines that we've been experiencing over the past few months. And so based on those studies of those two school systems, this doesn't increase the risk of spread in school as long as we're testing consistently. And so I just wanted to share those studies with everyone here. The other piece that I would really emphasize here is that if your child is symptomatic, please keep them home. These rapid tests are effective at detecting COVID, but sometimes they take a couple days. So if you know that your child was a close contact and they have a sniffle, even if that rapid test is negative, I would err on the side of caution for that day and just keep your child home if they're symptomatic with this policy. And we just ask that we partner as a team and a community and err on the side of monitoring symptoms and being cautious during this time with this new policy.
Great, thank you, Ms. Gaines. If you entered this Zoom session recently, we're about 10 minutes in right now, and we are recording the session, so you will have access to what we covered thus far. Mr. Doshi, let's go to the next slide. So our goal for this coming week is to return to school in the safest fashion possible. And to do this, we will be asking all families to test their kids before they arrive at school in the morning of Tuesday, January 18th. And so let me go into specifics about what we mean there. So there are two options for how you might test before returning to school on the 18th. The first option would be that your child could take a COVID test at a local clinic, medical office, testing site, or use an at-home test on Saturday, Sunday, or Monday coming up. We've offered some locations here. If you want to see those and take a picture of the screen, go ahead. But that would be one option for getting tested over the course of Saturday, Sunday, or Monday. A second option here is that students can visit, parents can visit on Friday, our middle school or our high school between the hours of 10 and 3 p.m. to pick up a self-administered COVID test. So we are offering those to every one of our families so that kids can be tested before coming back to school on the 18th. So two options there. To offer a bit more in specifics. So students here, once they have tested, are to upload a picture of their COVID test from at home or the lab with their name and the date in which the test was administered written on a sheet of paper between Saturday and Monday coming up. And that's by Monday at 5 p.m. so we can take stock of how many of our kids have indeed followed through with this really important step. And just as a way of appreciating people's time in taking that important step, we will be offering a $10 Amazon gift card. Next slide. So we're providing this just because it's something I know I messed up on the first time I tried to administer this test at home on my own. So I think it's just easy to look at this video and get a quick sense of how you do these tests at home. This is going to be an important step for families to take. And so this is a 3 to 4 minute clip of just how you do so. So we're going to roll that out now. So sit back and if you've got questions, throw them in the chat as it's playing.
Welcome to the instructional video for the iHealth COVID-19 Antigen Rapid Test. Let's learn how you can complete the test all by yourself and read your results in just a few minutes. For starters, thoroughly wash your hands with soap and water. We also need a clean, flat testing area. Take a moment to disinfect some counter or tabletop space. Once it's dry, lay out the following items from your kit, but don't remove them from their individual packaging just yet. In the box is a swab, a test card, a test tube. Your test tube will likely have the testing solution already inside, but in some cases, you may have received the solution in a separate packet. If so, no problem. Remove the larger lid and then carefully tear off the top portion of your solution packet. Pour the entire contents of the packet into the tube. Careful not to spill. Now, put the lid back on the tube and you're ready to go. Tear the foil packaging off your test card and lay the card upright so that it's ready to receive your test solution once you've taken a sample. Open the handle end of the swab package and pull out the swab. Be sure not to touch the swab end with your fingers or bring the swab into contact with any potentially germy surfaces. Which brings us to the fun part we know you've been looking forward to. Yes, this thing's going inside of your nose. But, lucky for you, the iHealth Rapid Test Swab is specially designed for simple, comfortable testing. It barely has to be inserted into the nostril, about 1/2 to 3/4 of an inch. Easy. In a circular motion, swab as if you were cleaning the inside of your nose. Note that this is not a matter of simply twisting the swab in place. When you've finished, swab your other nostril the same way. You think you got it bad? I'm the one who has to keep saying nostril. Insert the swab all the way into the solution. Twist it back and forth in the solution at least 15 times. And as you're removing the swab from the tube, squeeze the sides of the tube to wring every last drop of delightful solution and sample out of that swab. Then replace the large lid back onto the tube. You can now say goodbye to that swab. You grew so close in such a short amount of time. Now, let's test the sample. Remove the small dropper lid at the tip of your test tube and carefully squeeze 3 drops of solution into the receiving port on the test card. Set a timer for 15 minutes. You'll see your sample being slowly absorbed into the test strip, and over the next 15 minutes, your results will appear on the test strip as lines under the C and potentially the T. After 15 minutes, you can officially read the results of your test. But be aware, you only have another 15 minutes to read them before the results are officially considered invalid. It's a good idea to set another timer. Let's read your results. The C line is the control line. A line should always appear under the C. This tells you that the sample has been absorbed into the strip and that the test card is valid. If no line appears under the C, then the test card is invalid. If possible, you will need to test 3 drops of your sample on another card. The T line is the test line. A line will only appear under the T if you have tested positive for the virus. If there is no line under the T, then the test did not detect any virus in your sample. Nice! Be aware that depending on certain factors, such as how long the virus has been in your system, the line under the T may be very faint, regardless of how light or dark. Any line at all under the T means that you have tested positive for the virus. If you're unsure, you may wish to use a magnifying glass or hold the test card under a bright light for closer inspection. And that's it. If you tested positive, don't panic. Seek advice from a medical professional on your next steps. You can also go to cdc.gov for more information about how best to keep yourself and others safe. If your test is negative, be safe. Welcome to the instructional video.
Great. Thank you, Mr. Dosher. And so just to reiterate a couple of things here. So you now have a resource that you can go back and watch again, if you like. I often watch YouTube clips over and over to make sure I'm doing things right, even though it's often pretty clear. So you have that. And as we said earlier, so with this test to stay policy, if your child is in close contact with a confirmed positive case, we would provide a kit to your child at the end of the day, and you would be expected to administer a test on day 1, just in the way that was just shown in that small clip. And then based on those results, if they're negative, your child will return to school the next day, assuming they have no symptoms. If they're positive, your child will quarantine for 10 days. We'll talk a bit about what that looks like momentarily with regard to communication in school. And then there would be a second test on days 2, 3, or 4 with the same kind of same analysis. Negative, return to school if there are no symptoms. Positive, quarantine for 10 days. So I think with that, and I just say that we're being very gradual in this. My child goes to an elementary school in Clinton Hill, and he was back in school on the 3rd with very little guidance here. And I think things have been kind of rocky as a result. So we take safety seriously, and so we're taking the additional time to do things in the best way possible. Our return to school on Tuesday is a big deal. I want to do that extremely well. And often that to us means ensuring that our kids are arriving to school in a healthy fashion, so to prevent any kind of spread. So we've given you the 2 options for how you might take part in testing between now and Monday at 5. For students who do not arrive at school with proof of a negative COVID test between Saturday and Monday at 5, they will receive a COVID test from an external provider before attending class on Tuesday morning. And that again is just out of abundance of caution with safety in mind for our community. And so that would be Tuesday morning. So just to review the options for the return to school is upload a negative test result by 5 p.m. on Monday, that's the 17th. And with that, there would be a small gesture of a $10 Amazon gift card, and a child, after doing that, would go directly to class on the 18th. They can also bring the proof of a negative test result to school on Tuesday morning and go directly to class. And then if a child arrives without proof of a negative test, they will receive a COVID test in the morning from an external provider and attend class after receiving that negative result. So that, for us, reflects what we feel is the safest path forward to a clean, safe return to school on Tuesday. I think we can go to the next slide. So those are some of the major shifts, or what to expect both in the short term between now and Tuesday, and then the way in which our test to stay policy will work moving forward. I now want to spend a little bit of time talking about our preventative measures, where all of these measures have been in effect since our opening in September. We will continue to do them, and in some cases make some updates and ramp them up a bit further. So I want to talk through that. Let's go. So as we presented back in August, we have an 8-step layered approach to mitigation and reducing the possibility of positive cases in our school. They follow CDC guidelines, state and city guidelines. And so the 3 major strategies that we are leaning on here are, first, vaccination among community members. I've got more to say there. And then universal masking. I've got more to say there. And then in addition, as we've been discussing, we have been testing on site often and frequent at our school, more so than the DOE schools and peer schools. And we will be, in effect, ramping that up now with the use of these kits. We can move forward. So first, vaccinations. I'm going to go through each of these measures in a brief form. So I think first, with regard to vaccinations, just some updates on stats at our school. Among staff, 96% of our staff are fully vaccinated. A good number of our staff have been boosted, and we are encouraging that among all. We are not mandating it, but might look to do so if it makes sense. What does that mean? That's a good thing. It just means that there's a reduction of the risk of transmission to others, and it minimizes interruptions to instruction as staff are more apt to be healthy and not taking time off from school and with kids, helping them learn. Next. Among students right now, based on the data we have, about 1/3 of our student population is now fully vaccinated. This compares to overall in the city, about 72% of New Yorkers vaccinated as of earlier this month. What's this mean? This means that approximately 2/3 of students are not vaccinated. And so that has an adverse impact on our ability to completely provide the safest learning environment possible. So we are encouraging and will continue to encourage vaccinations among all of our students continually, as I have. So if I've been a broken record, I apologize, but this is just really important for our community. So we will continue to do so. And that's exactly what's said here in the next slide. And so for us, the benefits are as follows. If we've got our entire community vaccinated, everyone is less likely to be sick or get loved ones sick, and everyone is much less likely to experience severe disease, hospitalization, or death. And we're doing school more often without interruptions. These are all good things for community. So in red here, there are a whole host of sites throughout the city for getting vaccinated, and there's a site there. Perhaps we can throw that in the chat so families have it. Vaccines are free. There are many locations in the area. I think I had my booster shot on Flatbush Extension and Fulton downtown. It's a half hour, is really easy. And there's a small incentive of $100 for doing that and getting that done. So it is convenient. For us, just a note for families, because we do want to be able to provide the best information and support to you that we can. And so in the survey later on tonight, we'll be asking whether there's an interest for a local pediatrician from the Brooklyn Hospital to make some time to come in for a virtual session with their families to answer questions, concerns, et cetera. So look out for that in the survey. So the second mitigation strategy we have is universal masking. And so all human beings in our building will be required to wear masks, as we've had at all times. And that's all indoor spaces during Unity school hours. The one update I'd provide here, no, I'm going to go through this in detail because this is really important right now and is one of our primary strategies. So students are expected to wear their own mask brought from home, and it should completely cover their mouth and their nose. We strongly encourage students to wear higher level face coverings, such as a KN95 mask. Bandanas and neck gaiters are not allowed. The update here is that we have greatly increased our inventory of KN95 masks in the school with some of the updated guidance we've received from the CDC. So these are good things for safety. If a student needs a new mask during the day, this is just policy we've had in place since August. They can, we will provide them with a mask from our main office, so that will continue. And just a note, and this has only happened on a handful of cases, but if a student refused to wear a mask, that's serious and does put themselves, their family members, in our community at risk. So when that's happening, we are referring them to our deans of students and our co-principals. And there would be a parent meeting in the event that this is something that we're not able to rectify on our own. So we do ask that you encourage this and just state outright, this is just about safety. And it may be a bit of an inconvenience, but safety trumps that right now. So we've talked about on-site testing throughout the fall, but we will continue to test 20% or more of our students each week, regardless of vaccination status. So one update here is that in the past, if you were vaccinated, you weren't a part of that group of students who were randomly being tested each week. Now, all students are a part of that pool that will be randomly tested. And again, that'll be 20%. It's been 20% all along, and I think the DOE recently increased the percentage to 20%. So let's see. And that is not including the test kits that we're now also incorporating into our protocols. We'll continue with air ventilation strategies at the school. I guess the one update I'd provide here is just that it's cold outside, and we do have windows open as based on best practice. And with that, we have made some exemptions or some exceptions with regard to jackets in classrooms and things, just to sort of ensure that kids are comfortable and able to do and focus on their schoolwork. So that would be the one update I'd provide here. With screenings, we will continue with them. And so kids are asked to complete a quick questionnaire in the morning each day, just to reflect on how they're feeling. So they're certain that they're not experiencing symptoms and able to engage in the school day. We will also continue to have temperatures taken at the front door before entry in the building. We are piloting a new program, a software program that's a little better than some of the paper surveys we have, and just being able to sort of like assess and analyze the data we have, as well as provide us with more information. And so that's in form and in process now, but I provide that just because we're serious about how we're using the data we're collecting each day to inform our decisions. We will continue to maintain at least 3 feet of social distance between students as much as we possibly can. So no changes there. That's all I'll say. And our custodial staff, who've been great, will continue to clean the building throughout the day with more extensive disinfecting protocols in the evening. So no changes there, that will just continue. And then finally, self-monitoring systems. All families and staff are expected to continue to self-monitor for symptoms. And so specifically, Students should not attend or remain in school in person if they experience any of the symptoms below. So you see those listed, whether it's a high temperature, sore throat, a cough that's a little bit different than maybe the cough that one has if they have a kind of normal cough. Difficulty breathing, same sort of thing. If there's like an increase in difficulty of breathing for those kids that may have asthma already and have difficulty, but that would be a symptom. Diarrhea and vomiting, and then headaches, especially with a fever. Those are things to look out for. And so if a student is sick or experiencing symptoms, they are required to go home and get tested. So just a bullet note as noted here. In the event that a student is sick or experiencing symptoms while in school, they'll be sent home. And now, I guess the update here is that they will be provided with a rapid test kit to then test at home. And remain at home until they're better, or until, if it's found that they do have COVID, they're better and that quarantine time of 10 days has gone by. So here are some of the things that we highlighted back in August around strategies at home for preventing COVID. And so I think those are still live. The one that I would continue to underline is the first one here, to schedule a vaccination for your child and eligible family members. So doing these things go a long way in keeping our community and your home safe. So please be active here. So another update. One question that we presume folks will want to know about is, like, in the event that my child is quarantining for 10 days because of COVID, what might be expected? And I should say this, with this new variant, what we're experiencing is that this variant is more contagious and more people are getting sick, but the symptoms are more mild. So for our staff, where we did experience quite an increase in the number of cases at our school in December, a good number of those cases were similar to a cold or a mild sickness. And so with that, that's a good thing, although we want everyone healthy at 100%. With that, in the event that a child is home quarantining but feels healthy enough to continue to engage in schoolwork, 10 days is a long time to be out of school. Let's be real. And so in that time, we do want to offer some support that we can. And we take pride in this because I think this has been something which has been an issue for a lot of families in New York, where there just isn't communication among families where there's quarantining and the school, and it has adverse impacts on learning. So for us, here's what we can commit to now. So we will post assignments on Google Classroom, which is something we've been doing. Students will have access to all teachers via Jupiter Message, and so that communication can happen. And what's happened in the past is there may be a phone call, there may be a Zoom call, there's a way to sort of connect with teachers during off periods and things, and so that resource will continue. And then one new thing that we're going to embed in our programming this year is there will be regular check-ins with kids who have COVID and are at home, with a Unity staff member who will act as a tutor, an advocate, someone to just sort of help with managing assignments, assuming a child is home and able to do so, they're healthy enough to do so. So I think with that, Mr. Dosher, do you want to say something here with regard to that slide?
Absolutely. Thank you, Mr. Bogard. So at this point, we ask for you to complete, I'm going to drop this form in the chat for you to go to this website when you get a chance. It'll allow us to take attendance for who is here tonight. And it's also the same link where you'll be uploading the negative COVID results from over the weekend. And it'll tell us which preference you're choosing, if you want to go through our testing service or if you're picking up on Friday. So I'm going to drop this link in the chat. If you could fill it out when you get a chance, that would be greatly appreciated.
And I think what we're now going to do is move into the frequently asked questions from the chat. And I'm going to have a couple of colleagues to sort of shout out some of the big questions that may have come out tonight, and then offer an answer if we're able to do so at this time. If not, we promise to get back to you with questions that perhaps we want to huddle on and discuss the team before coming to an answer. So I think that's going to be Ms. Louisa, Ms. Duffney, and Ms. Williams.
So Mr. Beauregard, we can't actually see the questions in the chat, but I'm gonna point out some of the key things that Mr. Dosher said, and Mr. Dosher can chime back in with any of the questions he said. So that if your child has tested positive in the last couple of months, we are still asking for that negative test because there are multiple variants. Folks can become reinfected if we have an extra negative rapid test. It's just peace of mind for everyone. You can use any test you have at home or a test in your community. We have tests at the school site that we're willing to give folks, but I know that I have I'm a mother of two, so I keep a stock of them in my house at all times, and I would be using one of those if one of my children was a Unity student. Test kits can be picked up from either site. If you're a high school child, your high school child can pick it up at the middle school child can pick it up at the high school, if that's more convenient for your family, between 10 and 3 on Friday. And then you can use a photo of those tests as proof in that document.
Great.
Other teammates, key things we're seeing.
So to answer a question, there is no school on Monday. It's Martin Luther King Jr. Day. But on Tuesday, if a student is not tested over the weekend, either the at-home kit or from a lab, if a student shows up on Tuesday without a negative COVID test result, then they will be tested on Tuesday morning. But again, we're encouraging all of our families to get tested over the weekend, either through the Friday pickup or either through an outside lab.
So I think with that, there are kind of two next steps that we ask our families to take part in. First, again, is to complete that short survey. We are a small community-based school. Everything we do is on your behalf. And so having information from you, feedback from you, is something that we take pride in acting on. So we ask that you do take a couple of minutes to fill that out. And then secondly, the other step would be on Friday. If it's convenient for you, makes sense, is to pick up a test kit at either site between the hours of 10 and 3. And then to administer that test on Saturday, Sunday, or Monday, and to submit results via the survey that Mr. Dosher has alluded to. In the scoop on Friday, we will reiterate much of what's said. If there are any questions that we didn't answer tonight, that will also show up in the scoop on Friday. And you'll probably receive a couple of texts between now and then, just to provide some friendly reminders.
If it is impossible for your family to get your child tested between now and Tuesday, we ask that you do support in getting your student to school at their designated time on Tuesday. We will have professionals in testing students, and it's important that that moves smoothly so that we can be confident that all families and all children and all adults who enter the space are well.
Great. So I think with that tonight, it is 6:43. I want to thank the 190 community members who took part in tonight's session. In unity, there is strength, and there will be continued strength as we move forward with this one day at a time. So thanks again for being here tonight. And we look forward to seeing your kids on Tuesday.
I just got a question. If you are already tested, if you have a PCR that was taken in the last 24 hours, you could submit that. Otherwise, tests do expire. So we ask that the tests are taken from today on if they are PCRs. And then if they are rapids, please take another one. The tests don't expire, the results age out.
I got a question. If a student was tested last Monday, do they have to test again? Yes, we are asking that another test result. Again, even if it's just an at-home kit, that's great, but it's got to be from this weekend, please. Even if a student is vaccinated, we are asking, we're really happy they're vaccinated, but they still do need to upload a negative test result. The vaccinations are great at preventing severe COVID, and we heavily encourage it, but they do still need to get tested over this weekend, and you can upload the negative test result on that form.
We're requiring that of ourselves and all of our staff too.
I will share out the form via Jupyter message and email after this on Friday, and then again on Sunday. I saw a question, if the rapid tests are coming back with false results, how we know accurate? When used correctly, the at-home COVID rapid tests are very effective, and at this point in time, the best method we have.
I would add that we are combining that with strict masking at Unity Prep, which together should mitigate the amount of spread in the community.
I saw a question, if this happens again, or a lot of people are still testing positive, will we shift to permanent online learning? Any other school leaders want to take now?
The answer there is what we said back in August. What we feel is best is to make every effort to safely provide in-person learning. That's what's best for kids. So that's what we're aiming toward. And with that, a lot has happened over the past 2 years that I wouldn't have anticipated. So we're taking this one day at a time.
I got a question. Okay, PCRs will be accepted from what day? I believe Ms. Duffney, you said yesterday?
No, I'm sorry,
Today.
I messed up. We have a staff admission, and I'm holding a lot of information in my head. Please, if you're getting a PCR and you prefer to get a PCR after this point.
So PCR anytime between now and Tuesday, hoping every student will be tested, whether it be PCR or rapid.
Ideally, that PCR would be also taken on Friday or beyond, so that we are closer to the date when we enter.
What time should they report to be tested? We'll have more information about Tuesday's arrival coming up very soon. Are we encouraging staff and students to get the booster? Yes, absolutely. Can a family member pick up a test? Yep, the student themselves, parent, another caregiver, family member for the student. They can go to either site between 10 a.m. to 3 p.m. on Friday for the pickup. So question, can I get my son tested tomorrow? I work for health and hospitals, and it does take 48 hours. With the holiday, it may take some time. Anybody want to take that?
I can take that one. Our preference is that the test is taken on Friday or later, because that would put us, because there's no school on Monday, tomorrow would still put us 4 full days away from opening. If that is your family's only option, please do.
So if they are vaxxed and come in contact or test positive, do they still have to quarantine for 10 days?
Yes, right now, New York City school children do have to quarantine for 10 days. We'll update the community if that is reduced to 5 days with a negative test. But right now, yes, children do have to isolate for 10 days if they test positive.
So there's a delay in getting PCR results. We completely understand that. That's why we are providing at-home rapid tests that they can pick up on Friday. We've got more than enough for every single student. If they wanted to come by on Friday and pick them up, we completely understand the delay in PCR. If you're searching for a clinic, just ask them if they do rapid, ask for a rapid test. They should be able to give you that within an hour or a few hours. If you're doing an at-home test kit, either you have one already at home or you go to a CVS, Walgreens, or you want to come pick it up on Friday, that's available in 15 minutes. So that's why we're encouraging rapid tests at this point in time. So we have the most recent data available on Tuesday morning when students are walking through the door.
Many providers will let you take two tests simultaneously, one after the other, a rapid and a PCR, if that's the point of most comfort for your family.
So can you share what percentage of staff is fully vaccinated? I think we had that on an earlier slide.
96%
Thank you, Mr. Beauregard.
versus 72% in the city overall.
We are only taking questions in the chat right now, but we're here available to answer any questions you have. So if you have any questions, we're school leadership team still on. Feel free to throw questions in the chat.
And maybe let's take 2 more minutes for this, and then the other option would be for families to email COVID with additional questions.
Yep, I'll put that in as well. So again, if you have any questions, I always am monitoring the COVID@unityprep.org email account, and I'm more than happy to answer any questions. And then if you have any COVID related updates, questions, that's the primary email address to use. Somebody, I believe a student said, what about bathroom passes? Will we go back to disposable ones? A very specific question.
That is a fabulous question. I will note that and share it with our deans who owns a hallway pass system.
Thank you, Kayla. What time Friday? Friday, 10 a.m. to 3 p.m. So we are heavily encouraging everybody to get tested. It will make arrival on Tuesday morning a lot easier. And you'll be incentive for the $10 gift card. So if possible, please pick up a test kit on Friday or get tested over the weekend. For any student that does not submit test results from over the weekend, we will have a test result available for them on Tuesday morning. Is it safe for students to move from class to class?
We know that the highest likelihood of transmission is in spaces with low amounts of air circulation, where folks spend extended periods of time, and especially extended periods of time unmasked. At the high school, I can speak to that a little bit better. Our transitions are 3 minutes, so it's unlikely that children are in contact. Please encourage your children to wear their masks tightly on their faces, especially when traveling through spaces. The middle school has wider hallways with fewer folks in it and less transitioning. So we think that those places are places where students are less likely to spread the disease.
And thank you all. I think Mr. Berger, that was 2 minutes. I think we're gonna, so any other questions, please reach out to covid@unityprep.org. Again, we'll be on site on Friday between 10 a.m. to 3 p.m. distributing at-home test kits, or you're welcome to use a test kit you already have at home, or go to a lab or clinic to get a rapid test from over the weekend. But
Okay, thanks again, everyone. Have a great night. Be well.